If your physical health is the hardware, then your mental health is the software that runs it.
Absolutely.
So if your software is compromised, then your hardware cannot function optimally.
Hello, friends, and greetings from VLCC, and a very good evening to all of you. I'm Dr. Anju Ghei, Vice President and Head Preventive Healthcare at VLCC, your host for the session today. And with me are co-panelists, Dr. Madhusudan Singh Solanki, India's leading psychiatrist and head of the Department of Mental Health and Behavioral Sciences at Max Smart Super Specialty Hospital, New Delhi. And also my colleagues, eminent cardiologist, Dr. Dhiraj Bhatia, and nutrition expert, Dr. Deepti Verma. And each of these of whom you will be meeting very shortly. And you all know about VLCC. With VLCC, we have 310 locations in 143 cities across 12 countries in South Asia, Southeast Asia, GCC region, and East Africa. And of course, we are the leaders in beauty and wellness arena. Our wellness program, in fact, is recommended by IMA, the Indian Medical Association. And we've been having these webinars every month, every 15th of the every month. It has been going on for quite some time now. And these are actually our educational contribution to holistic wellness. And this is through quality information and healthy lifestyle choices. So the 7th of this month was World Health Day, and actually it inspired the today's webinar, which focuses on mental well-being. It's an important component of holistic health. And, you know, all of us over the last 2 years of pandemic, every one of us has been exposed to the uncertainty, the anxiety, what's coming next, experience the fear of the unknown, and our own fear of falling victim to the virus, and of, also dealing with loss of livelihood. So many people lost their livelihoods, and most of all, our loved ones. Yes, it has been a very, very, anxiety-filled time. And young children also have lost learning and crucial years of growth and social development. And that has affected us also as we work from home, juggling work and life. And so all of us got affected first mentally, and then over the time, even physically. Our earlier webinars in the series have focused on physical well-being, and today we will cover the emotional or the mental well-being. So everything that we talk about today happens in about 6 inches of space. And can you guess where that is? Yes, it's the space between our ears, a space which is filled with miracle of evolution we know as our brain. So it affects almost every decision we take, every action we perform, every feeling and emotion we feel, and every reaction. Yeah, so it can control us, or we can learn to control it. So its health is actually in our hands, or if I may say, it's in our minds. So today's topic is mental health, and we really look forward to learning so much from our experts on our panel. So whenever anybody or anyone mentions mental health, the word stress is automatically to follow. It's sure to follow, regardless of age and gender. So it's a sign of our times. Stress is a feeling of emotional, strain, a kind of pressure, a type of psychological pain, and we all felt it, experienced it. Some more than others, some longer than others, and actually some of us live with it all the time. And you know what? Small amount of stress may actually be beneficial, as any competitive athlete, or for that matter, even students appearing for an exam will know. It has all happened to us earlier, and we know it. Like, little bit of stress is good because it improves our concentration, our focus, our athletic or academic performance and motivation. But excessive amounts of stress, however, can increase the risk of strokes, heart attacks, ulcers, mental illnesses such as depression, and may also aggravate pre-existing conditions, something we have to guard against, and something that Dr. Madhusudan will be talking about in great details. So yes, so causes of stress are so many. They may be external, related to environment, but also most of the times it is due to our internal perceptions that cause an individual to experience anxiety or negative emotions surrounding a situation. So we have a good stress, which is called eustress. We have the bad stress, which is called the distress. And we can suffer from distress, or we can choose to de-stress or reduce stress consciously. The choice is our own. But learning and practicing conscious relaxation, de-stressing has almost become, has become essential sort of, life skill today. And that is what we are going to discuss, the preventive methods during our conversations today. But the first step is learning and understanding what we are dealing with. So we must remember that stress can affect anyone, and it probably will. It can be acute, short-lived, or it can be for a long period of time, but it affects everybody, right? So some people experience the emotional symptoms such as worry or restlessness or irritability, but some may have physical symptoms like headaches or muscle tension or digestive issues like I do. So stress can always, keep us from sleeping at nights, and it is one of the reasons leading causes of insomnia, which we'll be touching about in this session. And however, we don't have to live the way always in stress or in anxiety or in depression. We don't have to struggle in silence. We need to change what we can and manage what we can. So seek help when you need it, and you don't have to be positive all the time. Like Dr. Madhusudan said the other day, it is perfectly okay to be sad, angry, annoyed, frustrated, or scared and anxious. Having feelings doesn't make you a negative person. It's, after all, we are humans. So we don't have to control our thoughts, but at the same time, let them not control you. So we cannot always control what goes on outside, but we can definitely control what goes inside. So let us, dive deep into the subject and address your questions, which you have been sending us while registering. And I will invite our panel experts to do so. First of all, I am really delighted to welcome and introduce our first panelist for today, our special guest, Dr. Madhusudan Singh Solanki, Senior Consultant, Psychiatrist, and Head of the Department of Mental Health and Behavioral Sciences at Max Smart Super Speciality Hospital, Saket, New Delhi. So he's a gold medalist in psychiatry. Dr. Madhusudan is very well known for treatment of mental health issues all over. So he has worked with various tertiary care centers like Safdarjung Hospital in New Delhi and the BJ Medical College and Civil Hospital in Ahmedabad. And he has been the author and validator for mental health content on National Health Portal, a Ministry of Health, Government of India initiative, and he has been one of the authors of mental health training courses for primary healthcare doctors to implement national mental health programs. And he has several research papers in his name, and he's a noted speaker and writer on mental health issues on various platforms, as you will all see. And most interestingly, Dr. Madhusudan is also an internationally published music composer and songwriter and is widely recognized for his efforts in reducing mental health stigma using music and songs. And he strongly believes in patient empowerment and holistic healing. So that was so wonderful, Dr. Madhusudan. Welcome to you and thank you for joining us today. So wonderful to have you.
Thank you, ma'am. Thank you so much. First of all, thank you, Dr. Anju, for the introduction and the kind words. You have set the tone rightly. I mean, you spoke so well about stress and everything, right? I am really delighted and honored to be a panelist here today on this webinar, which has such a relevant topic, stress and mental health.
We are
And I
honored
sincerely
too.
thank you all for having me here.
Yes. So let me start with the first question. And the question exactly is, what exactly is mental health and why it is so important to take care of one's mental health? Dr.
Very good question. So, see, mental health, if we go by the definition which the World Health Organization says, it is a state of well-being in which an individual realizes his or her own capacity or potential, can cope with the normal day-to-day stresses of life, can work productively, fruitfully at work, can contribute to his or her community. So you see, it affects so many domains of our life. And if I tell you in some other words, like these days we have technology all around us, everybody is having a cell phone in hand. Your physical health is the hardware, then your mental health is the software that runs it.
Absolutely.
So if your software is compromised, then your hardware cannot function optimally.
Absolutely.
As simple as that. Now we are human beings. We feel, we think, we experience a range of emotions, and based on that, we act and react. And all that is part of mental health. So mental health is just not impacting how you feel, your own subjective sense of well-being, or your physical health. It also impacts how you relate to others. I mean, your relationships, your productivity at work, how you deal with problems in your life, your decision making ability, how you contribute to the society. All these things, or in nutshell, if I say, the whole gamut of things which make us human is determined to a large extent by the mental health.
Wonderful.
So that's why it is so vital and so important to take care of one's mental health.
Wonderful. So that is about mental health, but yes, like we said, mental health, and then we automatically go towards stress. So
Absolutely.
people are asking, what is then stress, and what happens, and what effects does prolonged stress have on an individual?
Right. So, see, stress is a physiological or psychological response of your body and mind to a situation which is regarded as difficult to deal with. So, whenever we are in a situation which we find difficult to deal with, we start experiencing stress. Now, that is just a response. A stress response starts happening in the body where your heart starts pumping more blood, there is more blood flowing to the muscles, your focus improves. So your body and mind, in nutshell, they start summoning up all resources to deal with that particular situation or trigger. Now, if you are successful in doing that, the stress goes down, and in the process, you grow. That's why, as you rightly said, we need some amount of stress to grow, to become stress resilient. That is called eustress. Right? But what happens if the stress is overwhelming, if the trigger is overwhelming, or if it is continuing for a very long time? In that situation, your capacity to deal with stress may get exhausted. And in that situation, the negative stress or distress, it starts manifesting. If I just put it in other words, like suppose if this is the equilibrium state, the eustasis, and if there is a stressor, it is tilted. Now the body and mind will do the stress response, and they'll try to bring it to the equilibrium again. And this process keeps on happening all the time whenever we are facing day-to-day stresses and problems in our life. Now, what happens when this is tilted and it can't come back to the equilibrium? It is at that time, the negative effects of stress, they start manifesting. And what are those effects? The chronic effect of stress, as you rightly said, it can affect the body, the mind, our behavior. In nutshell, our mental health and behavior both get affected by it. So you may start feeling fatigued or tired. You may have headaches, aches and pains in the body, maybe even chest pain sometimes, which people mistake for a heart attack and they may go to the emergency at times. Sleep disturbances, you may sleep less or you may sleep more. Stomach upset and changes in your libido. So this is grossly how it affects the body. Then in the mind, you may feel low, you may feel anxious, you may feel restless, or you may become forgetful. You find it difficult to focus and concentrate, or you may lose motivation to do things. You are into wellness thing, and you know how many people, they come and they just can't persist on the thing because they lack the motivation, because probably they are stressed out, right? And then effects on the behavior, like you may start getting angry easily, there is easy irritability, you snap, you may start using more of alcohol and drugs and all those things, smoking. Then you may have like in that case, sometimes people also have problems with undereating or overeating. That is also another thing that you people deal with.
Absolutely. Yes.
So all these things, and avoidance and withdrawal, some people withdraw when they are under stress because people stimulate us, situations stimulate us. So when we are under stress, we are low in energy, so we withdraw. So all these changes are seen with chronic stress.
Right. So like you rightly said, that we spoke about little stress, good thing, how it brings back the equilibrium, our body is trying to bring it back to the equilibrium where it started. And if it goes haywire, when it is long-standing, that's when the problem arises.
Absolutely.
Because every day, like you said, we are facing the stressors and our body is trying to sort of help us with raising our heart rate, and our blood vessels becoming narrower, we become more mentally alert, and our body is actually trying for the fight and flight mode. That's what we call it, is preparing our body to face the threat head on. But when it is prolonged, like you said, then the things begin to happen in all the systems of our body. Right.
Yeah.
So, Dr. Madhusudan, can stress cause predisposition to obesity and other lifestyle disorders?
Rightly said, ma'am. Yes, it does. Basically, when there is prolonged and unchecked stress, it releases certain harmful neurochemicals and hormones in our body, including cortisol and others. They predispose us to a lot of problems in the long run, including obesity, blood pressure, diabetes, then problems with heart health, problems with brain health, even flaring up of autoimmune disorders, skin issues, and the immunity also goes down with that. So you may have frequent infections. So you see a whole lot of lifestyle disorders, along with that, many other disorders.
Correct.
Stress can predispose us to. So this is how harmful it is if it is unchecked and prolonged.
Right. So very interesting, Dr. Madhusudan, because at our VLCC centers, we have also observed this very close link between obesity and depression amongst our clients. So obese people tend to have a lower self-image, leading to depression, and depression leading to, eating all sorts of wrong food. They lose interest in staying active physically. And like you said, they withdraw themselves. And that's how they keep gaining more weight in spite of all the efforts that we are putting in and they are trying to put in. So it's really very critical to break this vicious cycle Not easy, but necessary. It is necessary.
We tried. Yeah, absolutely.
Yes. So with the right family support and professional guidance and their own determination, and we have seen amazing results in our centers. So yeah. So Dr. Madhusudan, we would really like to know if one is undergoing so much of stress and is not able to manage it, how do a professional like you, and how do we manage stress at our own level, and also by taking, the professional help and maintaining a good mental health?
Right, right. So very good question, ma'am. Basically, if you start managing stress, your mental health will automatically improve. Right. So first step in management of stress is awareness. When you know you are under stress, when you identify that, then only you can take steps to rectify that. So becoming aware is very, very important. We discuss certain signs and symptoms, how you feel when you are under stress. So if you are going through all those things for a few weeks, that means you are under stress and you should take some steps to address it. Now, when we talk about managing stress, there are two very important tools. Usually there are problems in our life which make us feel stressful. Sometimes multitude of problems, multiple problems at one point makes you feel overwhelmed and then stressed out. So prioritizing is a very important tool. Prioritizing, I say simply, is what to do, when to do, and why to do. So when you have multiple problems troubling you, you must decide what to tackle right now or in these days, and what you can tackle later. So if something is avoidable right now, avoid that cause of stress for later address, so that you can address it later. And just select few things to be acted upon, so that the level of stress comes down, you don't feel overwhelmed. So identifying your triggers and the situations and the problems, then selecting which one to act now, which ones to be acted on later. And once you have selected that, then comes the another tool, which is problem solving. It's a skill that anybody can learn by practice gradually. That simply means that when you have identified the problem, break that problem into small parts, and for each part, think about the various solutions that can be used to address that part. You can take help of others also in your family, friends, mentors, teachers, to deal with a particular part. And when you decide upon a feasible solution, act on it. In the same manner, you keep taking one part by part and then keep acting on it. So this is how we can, narrow down the problems in our life to one or two problems to be addressed now, some problems to be addressed later, and then tackling each problem part by part so that it doesn't overwhelm us. This is one thing. Then in day-to-day routine, having a routine is very, very important. When you are dealing with these problems in your life, you should make sure that you have a structure to your day. Because often when we are overwhelmed with uncertainty and problems in our life, we feel a sense of lack of control.
Right.
And that makes us further insecure. That insecurity further breeds stress and anxiety, and that compromises your capacity to deal with the problems at hand. So having a routine gives you that sense of control, that yes, I have a routine set up, I'll do this, then I'll do that. So planning those activities in a day is very, very important. Then taking small frequent breaks. I cannot emphasize enough how important it is. Even if you are working from home or working from office, I suggest take a 5-minute break every hour. In that 5-minute break, you can take a stroll. You can just look out of the window, remove your eyes from the screen, listen to a song, or if you can't do anything, you don't have time for all these things, then just sit back, relax on your chair, take few deep breaths, close your eyes, and then start working again. So these small frequent breaks are very, very important to break that cycle where it stops stress from accumulating.
Right.
It's very important. Then taking good enough regular sleep. I think Dr. Bhatia would tell us more about that. It's
Right.
very, very vital, very important. Another thing is taking good nutrition. Dr. Deepti has joined us, I guess, and she will also be talking about that. So I'm not touching further on these two issues.
Okay.
Another important aspect is exercising.
Right.
Exercise reduces the level of stress by releasing happy hormones in the body. If you understand simply, it keeps you physically fit, it keeps you mentally fit as well. So I usually suggest that when you are at home or even at the workplace, take a 5-minute break every hour, walk for 5 minutes if you can't do anything else. And in that case, you will be walking 1 hour in 12 hours without going for a walk.
Absolutely.
And even 3 minutes of cardio every day. Dr. Bhatia would agree that some research is saying that even 3 minutes of cardio every day can protect you from cardiovascular disorders in the long run if you have a sedentary lifestyle. So
Right.
even a small amount matters. So it's like an account, your exercise account. You have to deposit few minutes whenever you can. If you have a stair, don't take the lift. If
Right.
you are sitting all day, take a break every hour, walk for 5 minutes, do some stretching, come back and work. So these small things very important, because often people have excuses that I don't have time, I go so early to the work and I come late, so I don't have time for gym, I don't have time for going for a walk. So if we inculcate these things in our routine, then it can be workable in the long run. You can continue that, and you will have the benefits, right? So these things are important in dealing with stress, keeping ourselves stress resilient. Then pranayama, yoga, and meditation. I cannot emphasize enough how important these things are. Gift of India to the world. And these things are so important for mental health. I often say that the way we brush our teeth and take a bath to keep our bodies healthy, in the same manner, sit 5 minutes with eyes closed, focus on your breath for your mental upkeep. It's just a regular maintenance, the deep breathing exercise and all that. This is just a regular maintenance for your mental health. The way we maintain our physical health, the basic things, right? Another important tool, which is highly recommended for dealing with stress and having a good mental health, is mindfulness.
Mindfulness.
Practicing mindfulness. It's a concept which is often applied to meditations also, in general also. Like, it has two components basically. One is attention, bringing your attention to the present moment, where you become aware of your surroundings, what is happening in your body, and acceptance, like you just observe things without judgment. So inculcating these two things in day to day, as well as practicing these things in form of meditation, can really help. A lot of mindfulness meditations are available online to start with. People can start that way, and they can learn also from an expert. But this is a very, very important technique. And when I'm talking about mindfulness, I would also like to talk about practicing self-love and compassion. Because you talked about something called as perspective, something, how we look at things, that also decides our level of stress to a large extent. That's why 5 people in the same situation will experience different level of stress. So there is an inner critic inside us. Many of us have that, rather most of us have that, which is constantly devaluing you, criticizing you that you could have done it better, you're not good enough. That chatter goes on and on, putting you down, making you feel inadequate, and that increases stress like anything from within. So when you think about self-love and compassion, actually we need to address that chatter inside. How to do that? First, again, awareness is the most important part. Just listen to that voice. When you feel you have not done something in the way you would have wanted, what kind of inner dialogue is going on? What is this voice telling me? And can I replace this voice into a friendly, compassionate voice, as if a friend is talking to me? How would a friend talk to me if I tell my friend that I could not do this thing as I would have wanted to? The friend would say these things. So replace that critic voice with a friendly, compassionate voice.
Wonderful.
So this is a small technique which we can do on a day-to-day basis to kind of cultivate self-love and compassion.
Wonderful.
Even practicing mindfulness or yoga and pranayam, where you connect with yourself, you start taking care of yourself. These things also, help you cultivate self-love and compassion.
Wonderful.
Apart from that, if you can select some phrases or mantras which convey you a sense of self-love, and if you can repeat them often, that also sometimes helps. So basically, uh, I say that if you do not love yourself, you will not be working on yourself.
True.
That's why self-love is important. It's not becoming complacent that if I love myself, why would I do anything? No. If you would love yourself, you would do everything to take care of yourself, to keep yourself in the best of spirits and health. That's why self-love is so important. Then, somewhat related to the self-love and compassion part are two more important things which also help us in managing stress. One is practicing gratitude. Gratitude is just counting the good things in your life and feeling grateful for that. So research says that gratitude shifts your focus towards positive things in your life. It gives you a sense of balance that not everything is bad. Because when you are overwhelmed by stress, mind says nothing is working in my life. I can't handle it. Gratitude says just opposite. It says so many things are working in your life right now. So it helps you have a sense of balance, which is very, very important because you're hopeless because of stress. So people who practice gratitude on a daily basis, they are found to be more stress resilient. So this is also one practice that we can inculcate or cultivate on a daily basis to deal with stress. Similar to this approach is nurturing your spiritual side. Again, spirituality means different things for people, but in general, it is connect. It is a connection that you have with yourself and the world around you, the life around you. It may mean prayers or meditations or observing certain rituals, and for some other people, it may mean just being with nature, listening to music, doing some art, or being in the company of like-minded people. So how spirituality helps in dealing with stress? It gives you a sense of context in life. It also tells you that you are not alone and you can surrender your worries and troubles rather than holding on to them. So this changes our perspective, and perspective matters a lot when we are dealing with stress. So
Absolutely.
nurturing that side also helps. Nurturing your hobbies, whatever you like to do, take out some time for that during the week whenever you can, be it music, dance, gardening, reading. That also helps. And last but not the least, spending time with family and friends.
Absolutely.
Quality time with family and friends, because it is proven that if you talk your heart out, your stress levels, they go down. And you can do that only in a safe space of your friends and family, right? So connecting with them, spending time with them, rather investing, I don't say spending, investing time and emotions in your relationships, because they help you deal with stress on a day-to-day basis, and they are also your resources to fall back on when you are overwhelmed by stress in your life. So this point is also very important. So if we just can inculcate few of these techniques and methods in our day-to-day life, then we can manage stress to a large extent, because stress is a part and parcel of life. We just have to learn to manage it in a better way. So this way, I think if people take it back, I think some of these things can be tried and they can help.
Wonderful, wonderful, Dr. Madhusudan. You are so right. Actually, I feel we humans are, we seem to be pre-wired to worry. And, like you said, the chatter in our mind is constantly there, to be doing this wrong, that, you're looking like this, that. And of course, this worry causes stress. And like you said, it is such a waste of time and energy. And so next time you find yourself worrying about something, so like Dr. Madhusudan said, just talk to yourself like a friend and
Right.
so if you can change the situation, then there is no need to worry. And if you cannot change the situation, there is no use of worrying, right? That's the way the saying goes. Worrying actually about so many things takes away, the time being there and enjoying the present moment actually. And so we must fight it. And that is why, like Dr. Madhusudan said, the mindfulness, being fully in the moment with the people around us. Why lose the pleasure of what we have today in the fear of tomorrow? Right? So, yes, that was so nice. So many good practical options to take care of the stress. So, next thing is going a little one step ahead. So, Dr. Madhusudan, what is clinical depression? And when should one seek professional help? Because this is happening so much nowadays.
Right, right. Very good question, ma'am. See, we all feel sad at times. If there is a situation which demands that kind of a response, like if you're sad because of it, it's a sad situation, then it's normal, right? And that's not clinical depression. Clinical depression is basically a combination of symptoms with a certain intensity and severity and happening for a certain duration. Then only we can call it clinical depression. So what are those symptoms? Like, for example, for a period of 15 days or more, if you are feeling sad most of the times, if you have lost interest in things, nothing gives you the pleasure as it used to give. There are changes in your sleep, there are changes in your appetite. You have negative feelings like hopelessness, worthlessness, or helplessness. You find it difficult to concentrate or focus. There is psychomotor retardation or agitation. And most of all, there are suicidal thoughts or self-harming thoughts. If these things in combination, many of these symptoms are present for a period of more than 15 days, and it is affecting your life negatively, your relationships, your work, then you may have clinical depression and you should seek professional help.
Correct. So this is what we have to look for, when it is happening for so many days.
Yes.
And you're not able to come out of it.
Yes.
That's when you need to take help. So, Dr. Madhusudan, how is this clinical depression managed at the professional end? Like
right. So clinical depression is managed based on severity of depression. Like if you have mild clinical depression, then maybe lifestyle changes and counseling is enough to deal with that and to come out of that. What if the clinical depression is moderate to severe? In that case, medications may be required along with lifestyle changes and counseling. And here I would also like to highlight one important aspect in our society, especially. People feel that if they take antidepressants or psychiatric medications, they are weak, they are not strong enough to come out of depression on their own. So I would like to tell all of those people a very simple thing, that suppose you have blood pressure and you take lifestyle measures and the blood pressure goes down, it remains normal. You don't need to take medication, right? But what if the blood pressure is not coming in control even after your best efforts? Or what if the blood pressure is high, so high right from the beginning that you don't have time to put in lifestyle measures to control it? Then you need medication from the beginning, or you need medication when it is not improving despite your efforts. The same goes for clinical depression. If the depression improves with lifestyle changes or the things that we discussed to manage stress, If it improves with that, you don't need medication. But if it is not improving with that, or if it is so severe right from the beginning that the person is suicidal, then medications are needed. And they are not habit forming medications. Only sleeping pills are habit forming. Antidepressants are not habit forming. So that is the message I wanted to give when you asked about how it can be managed. So this stigma and fear stops so many people from taking help, and precious lives are lost because of this.
Very true, very true.
And people keep suffering in silence. So this has to go.
People need to come out of
Yeah, this understanding, this awareness has to be there that these disorders are also clinical disorders like any other disorder. And if you can manage that with only lifestyle changes and counseling, then it's okay. Nobody will give you medications for that. But if it is not manageable with that, if the severity is like that, then there is no harm. Actually, it will protect your life. It will prevent you, from taking those kind of steps in your life and affecting your life in so many negative ways.
Absolutely. Right. Right, doctors. That's such an important message that do not let go. There's help around, there are professionals around, there's family, there are friends. Together, anything can be solved. And now we have such good medications, the combinations which are not habit forming and with least of side effects. And of course, they need to be evaluated.
Absolutely. If you need that for a particular duration, then only you should take it. But at least the help should be taken.
Right, right. So, Dr. Madhusudan, what are these red flags like in mental health, which we should watch out for our viewers? Like, when is it really important to seek professional help immediately? What are these red flags?
Very important question. See, red flags in mental health are the mood and behavioral changes, certain mood and behavioral changes, which if you notice in yourself or people around you, professional help should be taken. And what are those mood and behavioral changes? Most important, self-harming thoughts or suicidal thoughts. If you are having those thoughts, or if anybody around you is expressing those thoughts, then it should be taken seriously. Then agitated or violent behavior, that's another indication. Or repetitive, unusual or odd behavior. On the contrary, there is a withdrawn behavior can also be there, where a person who was very social, bright, bubbly, starts becoming withdrawn. That is also a sign something is not right. Changes in sleep, impaired self-care or hygiene, then a person acting bizarre or talking to self or hallucinating, extreme anxiety or panic is also another indication, and increasing substance use. Because many people, they take to substance to self-medicate the problem, but it makes it worse. So if you find your own alcohol or smoking or other drug use is increasing, or somebody else is doing that around you, then you should seek professional help. It's very important.
Absolutely. Wonderful. So thank you so much, Dr. Madhusudan. I think we have covered almost all the aspects of mental health. Of course, we'll wait for some questions from our viewers. But I would really like to thank you for sharing your experience and invaluable advice. And I'm sure our attendees and we too have benefited with better understanding of what mental health is, what well-being means, and understanding stress and its effect on us, on our relationships, and so many practical tips and suggestions on what we can, do on day-to-day basis and prevent, as well as what we need to do when we get affected. So better understanding will really remove many misconceptions and anxieties and help us lead better and happier, fulfilled life. And of course, we need to take better care of ourselves and those around us. And that's what is the message. Love yourself, right? Thank you, Dr. Madhusudan. We'll come back to you. And I'm now very pleased to introduce our second panelist, Dr. Dhiraj Bhatia. So Dr. Bhatia, as you all know, has over 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Fortis Escorts Heart Institute and Research Center and Max Super Specialty Delhi. So he's been actually honored twice by DMA and IMA as the Doctor of Excellence awardee. And he's been also part of the core medical research team, which has laid down guidelines for defining the management of obesity and PCOS in Asians. So he's also been the senior medical advisor to VLCC for the last 20 years. Good evening, Dr. Bhatia, and welcome to the webinar. And thank you so much for joining us today.
Thank you, Dr. Anju, for the introduction. And Dr. Madhusudan, that was very, very interesting. And I think very eloquently spoken, because a lot of, I think for a layman, it's important to understand. And I actually liked your, the last question which Dr. Anju put to you, what's the red flag? And okay, before we go ahead, what I want to tell the viewers is when we were growing up and we were in medical school, we had a term which was called psychosomatic illness, which we used to say that if there is something wrong with you psychologically, like what Dr. Madhusudan said, that can convert into chest pain, although you don't have a heart problem, or it can convert into, severe, stomach ache, and then you land up with a gastro, or you'll land up with a cardiologist. So now there's a new term, and that is because so much research has gone into new stress hormones, minerals, and certain vitamins, which there was no awareness of in the earlier days. So instead of calling it psychosomatic, we call it somatopsychic, So it starts the other way around. So you start having these illnesses and then it plays with your mind. So it's not. So I think, Anju, before you ask me any further questions, I just, the last patient of the day yesterday, just to make it more interesting and to, make everybody here understand what, it's not only I would say not only the patient's fault, not reaching a good psychologist or a psychiatrist, fault also lies with us doctors. So yesterday, I'm going to tell you a story which was really sad and heart-rending. I have this lady who comes to me, and she's a CEO, top, a company. And she sits in front of me, eyes fill up, and she says, I have changed so many doctors. I said, what kind of doctor? She's an orthopedician. So I said, why? She said, got nothing against them. They're very good. Some of them are very good friends of mine. But the pain in my legs is killing me. I've had MRI. I've had nerve conduction tests. I've had my vitamin profile done. I'm not getting any answer. And every time they get to physiotherapists, I keep changing and I keep getting this done. Somehow something clicked. And I asked her, I said, how's everything at home? And how much is the stress level at work? Because I know during COVID times, everybody's gone through a lot of stress and there are a lot of sales pressure and other things on. So, especially some of these corporates. So I said, let me try to find out. And when I talked about her work, she was happy. The moment I started talking about her two loved ones, she burst out into tears. So then I said, is there something wrong, your relationship with your husband? And she said, it's A1. He's a wonderful guy. Then I said, your son? She said, that's fine too. But as he grows older, then I said, what's the problem? She said, as he grows older, I keep worrying and worrying. And you know what, doctor? He got into an Ivy League college and I stopped him from going. So I said, that's the diagnosis. You are so stressed out. You should, these ortho guys, some of them may be my best friends. That's not the point, but it was missed. So I said, you should have been to a person like Dr. Madhusudan or to a good psychologist. So now, again, the problem does not only lie there, because in India in particular, there are very against going to a psychologist or psychiatrist. That becomes a real challenge. And she said, no, the family is going to say, मैं पागल हूँ, So I said, no, they're going to tell you, they will, she said, divide de denge. I said, no. So we go first to a psychologist. She does a scoring to find out if you really need medicines. And then we reconfirm it by sending to a psychiatrist. And then we decide if you really need medicines, you've already lost 10 years and you're screaming with pain and you're very upset and whatever. So it's so important from both sides, doctor, that trust, that relationship, to find out what is really happening. Now, also besides this, just between us here, I also feel that is part of the problem. But she does have RLS, that is restless leg syndrome, so that is there. And I was surprised nobody's got a ferritin level done. Now, leg pain, two tests which are being missed. People are doing D3, they're doing B12, but two tests which are very important. One is, take this message home today, because you'll have your mamas and papas, especially diabetics, screaming with pain at night. One is magnesium, must be tested. And second, very, very important, is you must get your D3, which is very, very important, and ferritin. Ferritin is super important. So, and not iron, because iron, is very unreliable. It tells you, if I've had a high iron diet the day before, it's going to show a peak. But ferritin tells you your bone marrow stores. So it really tells you where you are. So what I'm trying to build up here is the relationship between the doctors in general, or cardiologists and gastroenterologists, with the psychiatrists and psychologists. Unless you work together as a team, very often I've sent them to a psychiatrist or a psychologist, and they send them right back. They say, okay, you're right. Partly there was depression or anxiety, but there is a medical issue also. Look for it. So then we look for it. So, this thing has to be, unfortunately, the day when everybody is to work together is gone. Everybody is working on their own. Dr. Bhatia, cardiology. Another doctor, gastro. Another doctor, respiratory system. Unless you work together, it's not going to work. And please, like what Madhusudan said, if you need help, so be it. There's nothing to shy away from. If you don't want to take medicine, fine. See, what he said was very important. Everything what he said about keeping yourself happy, another, pranayam and yoga and spirituality, excellent. But sometimes you need to go a step further. But even if that is so, these are going to help you big time, really big time. Anju, I think time is short, but you can...
Doctor, but that is such a relevant point, because doctors, we all work in our silos. So when we have symptoms like this, we need to have a collective sort of a treatment plan, and try to see that our drugs are not causing any contraindications or mixing up, of various aspects. So it's a very, very relevant point, and I guess slowly we are coming to it now because of awareness and everything. So Dr. Bhatia, Dr. Madhusudan talked about so many hormones, the cortisol, adrenaline, noradrenaline, the stress-forming hormones. And so this hormone insulin, which is usually associated with diabetes, is also found to be released during stress. So can you help us understand how this affects the body? Because insulin plays a very important role.
Yeah, and especially from VLCC point of view, because we get obesity and 80% of the cause is high insulin. And that insulin is going high because the insulin receptors are blocked, which we call insulin resistance. Now, I have on this forum spent a lot of time talking about what insulin resistance and hyperinsulinemia is, which means high insulin. Because every time your receptors are blocked, it's simply the sugar can't go inside your cell to give energy. So your body releases, the pancreas releases more insulin and more insulin to open the receptors. Now, when there's too much insulin in the body, two things happen. One is the fatty acids are all pushed into your tummy, because that's where your adipocytes are. That's why we get central obesity. That is one. Second is you can't burn fat. So stress actually does this to a person. So you'll find people telling you that, doc, we are complying with the diet. We are doing our exercise. Why are we not losing weight, or why is our tummy not going? And I'll tell you why. The third most important thing has been missed, and that is stress. Because with stress, insulin will go up, and that's why insulin is called lipogenic. Now, quickly, I'm just going to tell you all, because we must, because people want, out of interest, will want to know what should be done. So number one is get rid of that stress. Get rid of the stress. You had a nice, long, interesting talk from Dr. Madhusudan, who's told you many ways to get rid of that stuff. Number two, or you can again have a conversation with him. Number two is exercise. And exercise, definitely, if you do resistance training, is better. But if you do long walks, that's great too. Number two is very important. Number three, obviously take less sugars. Because more sugar you take, the more insulin is going to come out. And to no use because the receptor is blocked. Then the same cycle follows again. Number four, have a good night's sleep. People who are sleeping less, especially if you're snoring, if you've got obstructive sleep apnea, insulin is going to come pouring out. And no amount of exercise is going to help you unless you straighten out your OSA, obstructive sleep apnea. So meet a sleep specialist if you're snoring or your parent has got a problem, especially male people. Then, in case, another very important thing is to take fiber. So fiber, people say, oh yes, fiber we've taken, we have satiety, so that's the way, right? No, that's not the only way. So fiber is like a prebiotic. Prebiotic means that all the good flora, the good bacteria are going to gobble it up. And you know what they release when they gobble it up? Butyrate. Butyrate opens the receptors. And that's what you want. So insulin becomes shunt. Similarly, if you take a lot of methi water, fenugreek seed and fenugreek, that has got saponins. That also opens the receptors. So, cut your stress levels down, do your exercise, take less sugar, get a good night's sleep, don't break your circadian rhythm, which means sleep as early as you can. Otherwise, you lose that rhythm, which is very important. We can discuss that next time. And you will feel you'll feel fresh. And of course, like I said, very important to do these two things, which is to take fiber and of course saponins. And lastly, D3. D3 also been found to decrease insulin resistance, to decrease stress. So it's a very important capsule. I can't tell you how important it is. So we'll come to D3 a little later, but this is very, very important.
Right.
So these are all the factors which will help you bring your insulin down.
Wonderful. So rightly said. And Dr. Bhatia, like you said, you know what, we humans are the only creatures in the world who deliberately spoil our sleep. All animals, even plants, sleep their quota of sleep, but we deliberately spoil our health. And so lack of sleep, like you said, causes stress, and stress can worsen depression. And like Dr. Bhatia, you were talking about so many hormones. And so this lack of sleep, what are the other hormones which get affected due to lack of sleep? And again, how do they harm us?
Yeah, so another, besides insulin, a very important hormone is your cortisol. So cortisol does something, if it goes high, if I sleep less, my cortisol levels goes high, and it really messes up the body. Number one way it messes up your body is it raises your blood sugar. So actually, in a way, it causes diabetes. So a lot of people say, how? Because cortisol causes something very interesting, causes new glucogenesis. Neo means new, glucose means glucose formation, and glucose means glucose, and genesis means formation. So new glucogenesis. So what it does is, your cortisol is high, my liver will start making sugar from other sources besides carbohydrates. It will make it from protein and from fats. So especially now we have people in VLCC. They said, Doc, we've stopped all our carbs. Why is the sugar still high? Especially when they're pre-diabetic. They do it, their sugars themselves. But why is it high? They are so stressed out. And maybe because of lack of sleep, maybe because of their work, children, whatever reason. There are many reasons, right? And then what happens is when the cortisol starts going up, that's why the liver finally becomes fatty liver, because of this reason. Because that glucose is first being formed, and then insulin is sitting there, which is going to convert your glucose into fat. So it's a whole cycle. You want to understand the physiology, otherwise it's going to be very tough. So again, cortisol, you want to decrease it. Do what Dr. Madhusudan said. Do your exercises, right? And cortisol diet, I won't say there's much there, but there's lots to do with exercise. Anju, you want to talk about exercise, so that's very important.
Yes,
I won't get into that, but it really helps both your cortisol, it'll help your fatty liver, and what else will it help? It will help your central obesity. You're killing not 2 birds, 3 birds with 1 stone. So that is very important in these situations.
Right.
Growth hormone in children, if they're stressed out, you put too much pressure, boards and all, the growth hormone comes down. Then they say, father is tall, mother is tall, isko kya ho gaya? Growth hormone is not coming out. So growth hormone is also very heavily related to stress. So, okay, I'm not saying Danda you have to do for your children because that's the way times are. We're living through these wretched times. We were so much into sports and all, and yet we did our studies. So it's become tough. But yet, as a parent, spend time, or as an elder brother, sister, de-stressing your child. Like he said, do some gardening with him, do some, maybe he likes to do badminton or whatever, swimming or anything else. Or photography, something needs to be done which makes the brain shant. Yeah, it's all connected. Very important.
Absolutely. Well, absolutely. So that's what it is, diverting your mind, cutting down on stress, which will automatically reduce your cortisol, your insulin, your growth hormone will be optimized, and that's how you become well and okay. So, Dr. Bhatia, what would you advise us for a good night's sleep? Because without using the sleeping pills,
Yep.
everybody nowadays, whenever they are not having sleep, they like to pop in all kinds of pills, which I'm sure must be harming. So, what do we do for a good night's sleep?
So number one message is don't take those sleeping pills. And if you are taking them, try to reduce them and go off. Because I can tell you, you can check, there are enough research papers showing that there will be early memory loss. Your memory is going to go for a toss, and you're going to say why, your cognitive function is going to go down. So very important, don't do that. Having said that, again, try to de-stress yourself before sleeping. Don't see anything which is very exciting, which is going to, like a serial or something or a movie. So try to calm down. Listen to some soft music, download something like sea breeze or seagulls or chimes or sea sound, or just a simple sitar or flute, but very, very soft. And don't read anything which is going to accelerate the thinking, because then again, your catecholamines, adrenaline, noradrenaline, they're released and they pump up your heart rate. Like you were saying, they were the ones who are responsible for your flight and fight. And at night, you don't want to either fight or you don't want to fly. So you want to sleep. So that's another thing. So also, the second thing is warm water bath, even in summers, lukewarm. Third is turmeric milk. Haldi milk is very, very important. Then you get these aroma soaps, which are also very, very good. There are certain things which are really helpful. One is magnesium. So magnesium, even if your levels are normal, they will be normal, mind you, because the bone releases magnesium in the blood if the levels are low. So you think that, you're fine, but you're not. So magnesium is very important to get a good night's sleep. And also ashwagandha, excellent. So get a good brand of ashwagandha and have a couple of capsules with magnesium. It'll really help you. Now, for those who are traveling, then melatonin is fine, 3 milligrams. Please don't get hooked onto melatonin. You take too much of melatonin, it's released on the pineal gland. That's what makes us sleep. So if you give it from outside, that gland is going to become lazy, is going to stop manufacturing. You will need more and more and more of melatonin. I know people who've gone to 20 milligrams. Then what will happen? You'll feel dizzy, you'll get nausea, you'll get gastritis. You're thinking, your cognitive function will go down. So very important that melatonin don't play around with. Strictly, the FDA is cleared it for jet lag, and that's it, because it fools the brain into thinking that it's nighttime and then you sleep. That's what you do. And of course, if you pass your sleeping hour, then God help you. So you have to change that, because you have to get your circadian rhythm back. If you have medical conditions that like OSA, obstructive sleep apnea, work on it. If you're a female, you may not be snoring as much. Females are more sensitive by nature, so they have fragmented sleep. They'll say, we get up 7-8 times. They'll give you that history. But most important history is daytime somnolence, which means daytime sleepiness, tiredness. They say, can't even drive a car. In a meeting, they're dozing off. So we are, so that is another very important history. So these are few things which we call sleep hygiene. And we tell people that, but tablets try to stay away as far as possible, because like I said, you'll get hooked onto that. I think, Anju, I should stop here. There's some questions also, and we can go to the next speaker.
Oh, okay.
enjoying this
Thank you so much, Dr. Bhatia. I think you're right. Our, biological clock or the circadian rhythm is so tuned to the sun. And if we have the natural sleep, which is the best, so that is why God has given us the thinnest skin on our lids. And when we are asleep and in the morning, when the sun rays they touch our thin eyelid skin, and it goes into our eye and stimulates the photoreceptors in the retina, which is in the back of the eye. It normally stimulates the brain, the hypothalamus, which raises our temperature, releases feel-good chemicals. And that's how when we get up, we are refreshed, feeling good and fine, which is a natural cycle, as opposed to getting up with alarm and closing all the windows with the curtains and having the unnatural sleep. That's what it is. So try to have as much as natural sleep without going in for the tablets that Dr. Bhatia talked about. And sleeping less than 6 hours a night for us, for humans, it actually diminishes or skews the natural activity of hundreds of genes, including those governing our immune system, our metabolism, our body's response to stress. So losing sleep is actually losing your immunity and leaving us unprotected and exposed to opportunistic infections and diseases. So like Dr. Bhatia rightly said, don't lose sleep. Be careful about it. Be mindful about it. So thank you so much, Dr. Bhatia. This is really very useful. And we now know the close link between restful sleep and stressful living and the hormones which regulate both. And with this knowledge and your guidance, I'm sure we know what to do and why. So let's go to the next aspect, which is, diet, exercise, de-stressing, and other healthy lifestyle measures also play a very significant impact on one's well-being, like all of us have just heard. So let's see how diet impacts us. So I'm now very pleased to introduce our next panelist, Dr. Deepti Verma, who with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC Skill Development. She has been a lecturer, a medical nutrition consultant, a writer, and an editor. She has been actually felicitated with several awards for her contribution for nutrition, including a Lifetime Achievement Award in September 2019, though she's a young girl. Welcome, Dr. Deepti. Such a pleasure having you.
Thank you so much, Dr. Ghai. It was indeed an absolute pleasure listening to Dr. Madhusudan and Dr. Bhatia. And actually, WHO now defines good health as a complete state of physical, mental, social, and emotional well-being, and not just absence of illness.
Right.
So that important is the mental and emotional health in today's time. So yeah, I'm like talking about this. We can just take it forward from there.
Absolutely, absolutely. So, Dr. Deepti, are there any foods that help reduce mental stress?
Absolutely, Dr. Ghai. There are lots of foods that help reduce stress and good cognition. And the first, of course, is the micronutrients, that is the vitamins and minerals, because actually our body does not really store vitamins and minerals. So it's important to be had on a daily basis. So day to day, we need to take them to fulfill all our needs. In fact, all the, cognitive metabolic functions actually need a lot of vitamins and minerals. So which are there in fruits and vegetables. And, so far it's always said that obesity could be one of the, is one of the primary cause of mental illnesses also. So we at VLCC have seen this, that we get patients, we get clients who are actually really obese. I mean, especially like grade 2 and grade 3 obesity, where, of course, like they're very, very low, they're very depressed. And as we have made them lose weight and made them scale that journey of a healthy weight loss, and then we have seen the way they walk and talk and, deal with day-to-day situations absolutely transforms. So much obesity has got to do with, so the first very important thing is to actually lose weight if the person is, grade 2 and 3 obese. And that itself takes care of the mental health. So yeah, nutrition wise, of course, it is fruits and vegetables that are very, very rich in vitamins and minerals, and also the whole grain cereals, especially oats and ragi and the different kind of millets that we have these days, and whole wheat. So these are primarily the things that take care of, and the next nutrient very important for the cognitive function and mental health is omega-3. And omega-3 actually comes in from, of course, the dry fruits, nuts and seeds, that is. And omega-3 is really rich in walnuts. So, we normally advise patients suffering from mental health, issues to actually consume about 2 walnuts on a daily basis, which is so important for their health because, the walnut, the way it looks like, it's like a miniature mini brain. So because it has all the nutrients, especially zinc also. Zinc is very rich in nuts and seeds. So that's also required for a good mental function. And the third very important food is also the pre and probiotics. And I'd just like to tell our viewers that actually, the gut bacteria that we have, which we call as the gut microbiome or the gut flora, they are also referred to as the second brain. So having these in optimum amounts is so important. But the kind of lifestyle we lead today, because we are overly into tea and coffee, alcohol, smoke, white sugar intake, and trans fat, processed foods, aerated drinks. So all these things actually kill our gut bacteria, which are so important. So they are there in the cecum portion of the colon, and they are the site for the synthesis of vitamin B12, which is so important for cognition and mental health. And over and above that, it also makes biotin and vitamin K, which is so important. And as Dr. Bhatia said, that it makes butyrates and propionates and acetates, the 3 short chain fatty acids is what we call it. That's also synthesized by the gut bacteria itself. So that takes care of the insulin issues also that Dr. Bhatia has already addressed. So it is so important to be taking pre and probiotics. So I'll just name some of the few prebiotics and probiotics. So prebiotics are the high fiber fruits and vegetables. Topping the list is bananas. So to be, we normally recommend a patient with too much of mental issues to have like 2 bananas. And you don't have to fear the intake of bananas majorly, also because, the fiber which is contained in the bananas is known as, it's oligo fructose. So which is absolutely okay. That's so much of a high fiber, and does not get absorbed, does not give rise to so much of insulin flux into the blood. So yes, that is what we would advise. Over and above that, it's raw onion and raw garlic. Raw garlic can be taken in the form of chutneys and raw onion in the form of salads. And besides that, the cruciferous vegetables, which is, of course, the broccoli and cauliflower and cabbage. So that also takes care of the prebiotics. And above, besides this, we also have certain probiotics that contain the bacteria in them. And curd and buttermilk is very popular, along with all the fermented food, kimchi salad. And we also advise people to actually knead their dough with which they make chapatis, say 2 days before they make it, so that it ferments a bit and it contains, all the bacteria which are overly healthy for the patients. So yeah, these are some of the foods which are very, very important for mental health.
Wonderful. Wonderful, Dr. Deepti. Just to reiterate what Dr. Deepti said, that our gut or the intestines, which is 28 feet long, has almost 100 trillion living organisms or microbes, which is 10 times more than our cells in our body. So actually we are teeming with microbes, and if they are good ones, then we are healthy, both physically and mentally. But if we have bad microbes, that affects in the opposite way, both mentally and physically, and also having a lot of issues like hypertension, cardiovascular disease, diabetes, and even Alzheimer's disease and cancers. So one has to really look into the food that we are having, fruits and vegetables and prebiotics, which act like fertilizers or food for the good bacteria. Dr. Deepti has named them. They are the typical fiber that we have, including isabgol or xylem husk, and all the fruits and vegetables, and raw garlic, onion, etc. And the probiotics, which are laden with the good bacteria by themselves. हमारी North Indian curry, dhokla, South Indian appam, idli, dosa, utpam, and pickles. All these are probiotics, and of course curds and buttermilk, like she said, are so common, and we can be taking this every day, which will be so good for our gut and for our mind, for that matter. Thank you so much, Dr. Deepti. And of course, there are certain foods which release happy hormones. Are they really such foods, or it's just a myth?
Yeah, there are certain foods. Actually, we have, the units of proteins are called amino acids. So there is one particular amino acid by the name of tryptophan, and it's an essential amino acid. That means we need to take it from the diet. And that essential amino acid actually said to be precursor of melatonin and serotonin. So serotonin is something that calms us, relaxes our muscles, and actually also works well with the nerves and, soothes and calms the nervous system and puts us at ease. So yes, to a large extent, it takes care of a good sleep and also takes care of depression and mental issues and overthinking and anxiety. So those foods, of course, milk is one of them. For the longest time, I think in India, Dr. Anju, we've seen people take a warm cup of milk before they go to bed. So actually the reason is this, because it actually gives a good sleep and calms the mind and the body and all the muscles and nervous system. So that is the reason how actually milk helps. And so yes, dairy products, which are very, very good in tryptophan. The second very good food, for tryptophan is bananas. So that also eases us and calms the muscles. And now we'll be having the season of mangoes. Everybody loves the king of fruits, and that also eases and relaxes us and really helps the nervous system and, removes anxiety, depression, and overthinking. So these are the foods actually.
Wonderful. So yes, and of course, like Dr. Bhatia touched upon how sleeping well is so very important, both mentally and physically. So are there any dietary practices which one should adopt to have a restful night's sleep? Dr. Deepti?
Yes, absolutely. So, the very important thing is that we normally advise people to eat their dinner 3 hours before going to bed. And the going to bed time should, be somewhere between 10 to 11 p.m. in the night, because actually these days I see that it's just getting late and late and late, and people are like sleeping and they are on their, social medias and things like that. So very important, first, of course, to have a dinner early. The dinner has to be light again. It should be something like a khichdi or some cereal and vegetables, something which is home cooked, something which is not processed and not deep fried. And third very important thing is to keep off the gadgets, which are very important, because the screen of the gadgets actually emits the blue light, is what we call it in our field. And that blue light actually stimulates the optic nerve and, of course, stimulates the hypothalamus. So as a result of that, it is very difficult for the pineal gland to release melatonin. So to be off the gadgets at least 90 minutes before going to bed is very, very important. Instead, I advise all the patients to actually go for a print read, because it actually induces a great good night's sleep. And very important, as Dr. Madhusudan said, that to be grateful. So this is a personal practice that I do, that I count all my blessings for the whole day as to how good the day went and how all the good things that has happened, throughout the day. And then, of course, I say thank you for the best thing that happened during the day. And this has been my ritual, which has given me an amazing sleep. So yeah,
wonderful,
these are the things that I would advise.
Such a simple thing and so effective. Absolutely. Gratitude and thanking for everything good that we have. So wonderful. So thank you so much, Dr. Deepti. Food is always a special interest because it's always in our control, and wise choices can have such significant impact on our overall health and well-being. Thank you once again. So now let's turn to exercise and how it impacts our mental well-being and also fights the effect of stress. So yes, exercise is very important. Dr. Bhatia already mentioned, Dr. Madhusudan also mentioned, like how it opens up the receptors for insulin and releases happy hormones, the good chemicals of endorphins and serotonin, and it also reduces the bad hormone, the cortisol or the stress hormone, giving our mood a natural sort of a boost. Also, even a low intensity exercise, if you're doing, like Dr. Madhusudan said, it's better to just get up after every hour and just move around. Even that small activity, when it is collected over the day, is able to release certain very healthy proteins in our body. BDNF, we call it, brain derived neurotrophic factor. And these are growth factors, and they actually, what do? They help in growth of new nerve cells and new connections in our brain, which is so very important, to take care of conditions, mental conditions like depression and anxiety, and they have a better calming effect from the brain during times of stress, right? So physical activity actually is so important that it distracts you from negative thoughts and emotions, and it can take off your mind from the problems that you have been facing, and it makes you go into sort of a Zen-like state. And you feel so nice and light and happy, and that glow after the exercises cannot be missed. So exercise is also a very important source of social support. So then, like, you go out with your friends, you're going to the gym, or you play a sport, and there's so much of interaction which really calms you down, which makes you happy and feel good. And so one will ask, what kind of exercises will help the mental health? So anything that you enjoy, it may be weightlifting or cycling or swimming or running, whatever choice you have, whatever you enjoy, and whatever you can stick to it. It may not be a single kind of exercise every day. You can mix and match to it, change it every day, experiment, and don't be in a hurry to see the result immediately. It takes time for the body to show the good benefits around, but everything is happening whenever you are moving and you're doing your exercise. Yes, very important aspect is your medical history. Current medications that you are taking and diagnosis or conditions, they play an important role in your ability to exercise safely. So it's very important, if you do have any conditions, to consult your doctor and determine the best form of exercise and intensity level for your physical condition. In any case, like Dr. Madhusudan said, avoid being sedentary, take breaks from sitting, move and walk around as much as possible, because being sedentary and sitting too much is like smoking. It's like linked to increased risk of obesity, heart disease, type 2 diabetes, and some even types of cancers. So never ever lose an opportunity to sort of get up and walk whenever you can. And also little bit, some tips, if you're just starting off with exercise, remember not to go full steam, because you're so enthusiastic to get started. You have understood the benefits that it's going to give you, but always remember to start slow, progress gradually, don't overdo it. You may push yourself to extremes and then end up with a physical injury, which will bog you down, and you might just stop doing it. So yes, the question is, many people ask, how much exercise should we do? And what type of exercises? So, one is, don't be sedentary, keep walking, keep doing something every now and then. But a regular exercise of 30 minutes, a workout in a day, at least for 5 days a week, is just enough to keep you fit. All right. And mentally also, it works wonders. But if you're, trying to lose weight, then it has to be increased. So I'll tell you what are the exercises you need to do. Suppose the first one is, of course, everybody talks about it, aerobic activity or the cardio activity, which uses our large muscles while, it brings up our heart rate, it improves blood circulation, oxygenation of body tissues, including that of brain. So when you're using such large muscles, they help you burn more calories and it reduces your weight, it increases your sleep time, lowers your blood pressure, and so many things, and even controls your sugar level. It makes you stabilized. It reduces the risk of falls, and of course, it boosts your mood like anything and builds up the overall stamina. Quite a basket of benefits, right? So if you have to lose weight, then aim for 60 minutes of low to moderate intensity aerobic exercise. You don't have to do it at one go. You say, oh, I don't have so much of time. 1 hour is so much. Not to worry. Break it up into small sessions, 30 minutes twice or 20 minutes 3 times, or even more smaller ones. Doesn't matter. The activity is what counts, for the whole day. And examples are very simple: brisk walking, slow jog, swimming. Now it's so hot and warm. You can go for swimming if you like it. Cycling, treadmill, cross trainer, stationary bike, rowing, even dancing. Just go and dance. It is such a stress buster. And sports activities, you can play badminton, you can play tennis, whatever you like to do. And if not anything, the stairs are there. Climb the stairs up and down, provided your knees are fine. And also you can do the skipping, provided you are not very much overweight. So it's a no-no if you're obese and you start skipping and then you end up with pain in your knees and joints. So as little as 5 to 10 minutes of aerobic exercise helps to improve your mood and reduce your anxiety. And regular programs lasting for 10 to 15 weeks, and sure enough, it's like a treatment for any mental problem. And Dr. Madhusudan already told us about it. Just 2 or 3 simple tips. Always begin with a warm-up. Don't be in a hurry to just, fly. And also give enough time to cool down. Let your heart rate come down before you suddenly stop, and listen to your body. If at all you feel that your heart is racing and you're getting too tired and fatigued, just slow down, or you may even stop and take rest, right? And of course, Dr. Bhatia talked about strength training. We all miss it. We say, okay, we are doing walking, swimming, that's enough. But strength training plays a very important role, because it is building up our muscles. It is building up our bones. It is burning our fat. It is improving our metabolism. And it prevents the loss of bone and improves your speed, and definitely reduces stress. And when you do the strength training, the kind of shape or toned up body you get makes you feel so good. And women, don't you worry, doing the strength training with weights, etc., it's not going to make you manly or build bulging muscles like men, because of our protective female hormones. So they will not let you have the bulging muscles. You will in fact have a very shapely body you have always wanted and will be envied by all. So definitely do strength training. And how can you do that? You can do at home. You can use dumbbells. You can do resistance tubing. If you don't have dumbbells, just use water bottles. You can add the water, of course, and put the sand if you want to increase the resistance. And of course, gym is always there. But, like me, I'm not a gym person. I don't like to use the weights, etc. So you can use your own body as weight and do resistance training like crunches, lunges, squats, planks, arms and leg strengthening exercises. In fact, yoga and Tai Chi, though very gentle, also fall in this group. And you know what, just 15 minutes every day, or just 30 minutes, maybe twice or thrice in a week, is a very good option to do this strengthening exercise. Make a commitment to your exercise plan and don't forget it. And of course, in the end, you definitely have to do some flexibility exercises and balance exercises, especially for older people. As we grow, we have a problem with balance, and the worst thing is to fall down and get fractures, etc., which is so difficult to manage in old age. So you can add some of this fun activities, like standing on one leg. Of course, there has to be support around, and walking backwards, or training your back muscles of the arms and legs, which prevent the back pain and also strengthens your core. And of course, it definitely reduces your stress and anxiety, helps to balance your body, and keeps your joints and bones moving and strong. Yeah, so that is about exercising. A must, a must, a must to have a stress-free life. And definitely, we have to learn to relax. And there are various techniques around. One of them is called the Jacobson's relaxation technique, which is very simple. You can have a look in the YouTube if you want to know how it is done. It is just, from head to toe or from toe upwards, you need to contract various muscle groups one at a time. So first you contract your facial muscles and then release it, and then do the deep breathing, and then come down and contract the neck muscles, then the shoulder muscles, the chest muscles, the tummy, the hips, the thighs and legs and toes, like that, one after the other. Contract, release, and deep breathe. So it's a very simple thing you can do while sitting, you can do while lying down. It's called Jacobson's relaxation technique. Very good for you to go to sleep if you're not able to sleep. It's like, like you do Shavasana. It's a little one step ahead than that. Also, I don't have to do everything which is so technical. If you don't want to do relaxation that way, just listening to music, your hobbies, being with people you love and the company you enjoy is also very calming and good. And the thing, like Dr. Madhusudan said, declutter, and go one step at a time and take care of your problems. In fact, cleaning maybe your space and home and organizing your surroundings also gives you a lot of relaxation. So that's what it is. And so let's see if we have many more questions from our attendees. Yes, there is one for you, Dr. Madhusudan. We have a question, and we have it, which is very relevant to our VLCC clients and patients who come to us. It's for people who are obese and overweight, and also are not very happy with their image, and they are stressed out. Sometimes they are depressed, and they end up get into binge eating. And how much ever they stop, they have control for the whole day, and just before sleeping, they'll have a whole jar of ice cream or a whole bar of chocolate, and it just happens. And that's what doesn't let them lose weight. So how can we break this vicious cycle?
Very, very good question, ma'am. And first, I would definitely like to say that whatever inputs and facts you, Dr. Bhatia, Dr. Deepti, you all have provided, they enriched me as well, and they must be very useful for all the audience and people out there. It was wonderful.
Thank you so much.
So coming to this question, we also see a lot of people struggling with this, that they end up emotionally eating. We call it emotional eating, you can say, binging upon junk or the food that they want to avoid, right, basically. So as always, the first step is becoming aware of it. Identify your triggers. I mean, what triggers, what happens in your mind and body when you end up going for that tub of ice cream or anything else that you were, telling yourself not to have, So if you can avoid the triggers, great. If you cannot avoid the triggers, you have to learn to manage those triggers in a different manner. Like next time when you feel that urge, what else can you do instead of reaching for that particular food? Can you talk to someone? Can you take a small walk? Can you take a warm water bath? Or can you listen to something? Can you distract yourself into anything else, right? That can manage that particular trigger at that point. And once that impulse goes, it may be easy for you to, maintain your promise to yourself that I would not take it. It's impulsive most of the time, right? So second thing is, make an environment where this is not facilitated. Like, do not keep junk food at home. If you don't have ice cream at 12 or night you are feeling like having an ice cream or chocolate, if you don't have it, you will ultimately
Right.
reach for the jar of nuts,
Right.
because you have only that option available. So don't keep that option available there if you can, so that even if you have that impulse, it gives some strength to you because you don't have that option available, so you can focus on other things instead of going for that thing. Taking high protein and high fiber breakfast first thing in the morning can keep these kind of emotional eating at bay. Taking regular meals is very important. If you go for, you don't take meals regularly, then in between you will end up binging on these kind of foods. Another technique that I have found very useful is drinking at least, 500 ml of water or something like that just before you are about to have a large meal, or you have that impulse inside to have something, because somehow it fills the tummy and that craving goes down.
Absolutely.
Again, exercising is very important because all these cravings and impulses, they are coming through neurotransmitters and imbalance of certain hormones in our body, and exercise brings that balance back, so you don't have those signals coming from your body to have those kind of foods. Practicing mindfulness is again very, very important. And get yourself evaluated. If you think despite your best efforts you're not able to control this, maybe there is underlying anxiety, underlying depression, or an eating disorder or anything else which needs to be addressed properly. So this is how I think it should be approached and can be.
Wonderful. I'm sure this has helped many people. And so there is one of the viewer, Deepika, and she says that I want to know about myself as I do so many things repeatedly without any reason. And I'm doing it because of fear or bad imagination. I've tried to control it, but I'm not able to do so. Can you please help me?
Yeah, what she is indicating is mostly magical thinking. Like some people repeat certain things because their mind links it to something bad, that if you don't do this thing these many times, something bad will happen.
Right.
It can be a symptom of obsessive compulsive disorder. So I would suggest her to seek help for that. It can be treated.
Yes, very true. So help is always available, and if you are not able to come out of it, it's better to get your.
It's a little different symptom from the usual washing of hands and those symptoms of OCD. So it's not easily recognizable, but I think it may be the possibility.
There is a very, very common thing that we all go through. The anonymous attendee, she's written, "Good afternoon, ma'am and sir. I have a problem of overthinking. If anyone says anything bad, I keep thinking about it for a long time, and I don't know how to deal with it."
It's a common thing, and usually, it comes from the fact that we are looking for too much approval and those kind of things from others. So whenever something negative comes, it just hits us and it keeps on, revolving inside. taking away all the peace of mind that you have. So whatever steps we discussed, in which you can start loving yourself, becoming more forgiving for yourself and others, cultivating compassion,
2 minutes.
and all those things are very important because they will make you a little more stronger in dealing with these kind of things when you end up overthinking about certain thing which was told to you, right? Apart from that, whenever you recognize that you are into that thinking mode, let it happen for a while. Notice what kind of feelings and sensations you're feeling. You're feeling angry, you're feeling hurt. Feel it for a while, and then after a few minutes ask yourself, what can I do to change it? And then start that activity. Make a list of few activities, which may be taking a walk, talking to someone, watching something, cooking, gardening, anything, organizing your space. As you rightly said, it comforts us. So whatever you can do to break that cycle inside and brings your focus away from it into something positive for yourself, try doing that.
Wonderful.
So this is how we can deal with it.
Thank you. Thank you so much, Dr. Madhusudan. I think we have covered almost all the aspects. And in closing, so let us remind ourselves of very few simple tips we have heard today, and do and use whatever works for you. First of all, simplify your life where you can. Break up big tasks into small chunks and celebrate completing each bit. And remember to breathe. Deep breathing is our nervous system's love potion, love language. And do it very often, like Dr. Madhusudan said, like we are brushing our teeth or doing other things. Spend just 5 minutes for deep breathing. It'll actually nurture you. Of course, healthy diet, maintaining healthy weight, enough physical activity, not to smoke, limit the alcohol, and regular medical screenings. Get to know your insights, avoid stress, practice stress relief techniques, and finally, seek professional help whenever you need to. Don't wait, don't be hesitant, don't be shy. It's going to help you and nobody else. As best as you can, fill your life with friendship, family, pets, laughter, and love, because real relationships are the best support for lifelong healthy life. And finally, keep smiling. Feel good about yourself because you are special, and happiness is so contagious. Surround yourself with happier people, and that will make you happy too. Laugh a lot. Get serious about fun. And I mean really serious. And everything takes a little effort to begin with, but it's never too late to take care of yourself and those who matter in your life. So in the end, at VLCC, our focus is on the combined benefit of managing diet, activity, and lifestyle to keep our clients healthy and well for life. And that's why our team of doctors, physiotherapists, nutritionists, and therapists, and wellness counselors, they all work together on a custom design regime for each and every client to help them achieve their wellness goals and not just weight and centimeter loss. So thank you all for attending our webinar and guiding our conversations with your wonderful questions. And thanks also to wonderful panelists, Dr. Madhusudan, Dr. Bhatia, and Dr. Deepti for all the learnings today. And we hope you now have better understanding of your health, for yourself, for someone you may know. And if you wish to know more, there is always a VLCC center near you where a team of experts are just waiting for you. Wish you all a very healthy life filled with happiness and fulfillment. Good evening to you all and have a wonderful day. Thank you.
Thank you. Thank you.